The overall goal of this procedure is to monitor synaptic transmission through the giant fiber pathway by recording postsynaptic potentials from a dorsal longitudinal muscle, or DLM, and from a tergotrochanteral muscle, or TTM, following direct stimulation of the giant fiber interneurons. This is accomplished by first properly securing an anesthetized fly in a dish containing a dab of wax. The next step of the procedure is to insert stimulating, ground, and recording electrodes into the fly. The final step of the procedure is to stimulate the brain and record responses from the jump and flight muscles. Ultimately, results can be obtained that show changes in the functional properties of the giant fiber pathway as a function of a genotype, age, temperature, etc., by recording the amount of time between the stimulus and the response, and by counting the number of successful responses following a high-frequency train of stimuli.
This method can help some of the key questions in the field of neurophysiology and help examine the functional properties of neuronal pathways. This technique can be employed either as an introductory experiment that is followed by genetic or molecular analysis, or as a way to assess physiological and functional properties in animals carrying a known mutation.
Visual demonstration of this method is critical, as the preparation and impalement steps take some time to learn. Because flies are comparatively small, there's a certain level of steadiness and coordination that needs to be acquired before experiments can be done correctly.
These experiments use a standard electrophysiology setup comprised of a stimulator, a stimulus isolation unit, 2 microelectrode amplifiers, a data acquisition system, and a computer with collection software. Additional equipment includes a Faraday cage, a stereo microscope on a boom stand, a vibration isolation table, a light source, and a recording platform. 5 micromanipulators are used. 2 micromanipulators require fine controls for positioning the recording electrodes, while the other 3 micromanipulators only require gross controls to position the 2 stimulation electrodes and the ground electrode. The manipulator for the DLM recording electrode is placed at the tail end of the preparation. The micromanipulator for the TTM recording electrode is placed between the experimenter and the side of the preparation. The 2 micromanipulators for the stimulation electrodes are placed at the head of the preparation. The micromanipulator for the ground electrode is placed at the far side of the preparation. Pull glass recording microelectrodes with resistances of 40 to 60 megaohms and store flat in a dish supported by wax. Use 2 electrolytically sharpened tungsten electrodes for stimulation. Use a tungsten wire or a 3rd electrolytically fabricated electrode as the ground. Attach the stimulating and ground electrodes to the micromanipulators before the start of the experimental session. They will not need to be replaced for the duration of the session. Once your equipment is set up, it's time to prepare the flies. Anesthetize the flies by cooling them on ice for 10 to 15 minutes. Use forceps to transfer the fly, gently by its legs, to a dish containing a platform of soft wax, sloped at an angle of approximately 45 degrees. The next step is to secure the fly in wax. Orient the fly ventral side down, with its anterior facing upwards on the slope. Using a pair of fine forceps, extend the legs outwards in pairs and push them into the wax. One should be familiar with the location of the muscles to be recorded from before beginning this experiment: the dorsal longitudinal muscle, or DLM, and the tergotrochanteral muscle, or TTM. The subcuticular attachment sites of the DLMs correspond with the region between the thoracic midline and the anterior dorsal bristles. The TTM attachment sites are located dorsally of the posterior and anterior supraalar bristles. Making sure that the wings will not obstruct access to the DLM or TTM fibers, hold the wings outward and glue them to the wax. Using a pair of fine forceps, pull the proboscis outward carefully and secure it by immersing into the wax. This is a critical step that requires some practice since the proboscis is soft and is easily detached from the rest of the head. If that happens, discard the fly and start over. Failure to secure the head in this way leads to problems when inserting the stimulating electrodes through the eyes. Once the fly is anchored to the wax, place the preparation under the stereomicroscope inside the Faraday cage. Orient the fly sideways with the head of the fly to the right of the experimenter. The next step is to insert the electrodes. Bring the electrodes close to the sites of insertion with the help of the micromanipulators to facilitate their proper placement and subsequent recordings. Without looking through the scope, lower the ground electrode into the posterior end of the abdomen using the adjustment wheels on the micromanipulator. To place the sharpened tungsten stimulating electrodes in the brain, use the micromanipulator to position the tip of one of the electrodes so it just touches one of the fly's eyes. Do the same with the other electrode so both electrodes are just touching the outside of each eye. Then push the electrodes, in turn, through each eye about 2 to 3 millimeters, so the tips of the electrodes reach the brain situated at the back of the head capsule. Correctly placed electrodes will activate the giant fiber system. To test that the stimulating electrodes are placed correctly, apply a short stimulus of 30 to 60 volts across the stimulating electrodes and look for movement of the wings and twitches of the flight or leg muscles. The next step is to backfill the glass microelectrodes with 3 molar potassium chloride using a Hamilton or heat-pulled plastic syringe and place them into the fine control micromanipulators. Properly inserted microelectrodes can be used for several rounds of experiments. The first recording electrode will be inserted into a DLM fiber. There are 2 bilaterally symmetric DLMs. Each one is composed of 6 individual muscle fibers. The recordings can be done from any of the 6 fibers, however, the most commonly used are the DLM fibers 45A and 45B, due to their good accessibility through the dorsal side of the thoracic cuticle and the fact that both fibers are innervated by the same motor neuron. Using the micromanipulator placed at the tail of the preparation, insert a recording electrode into DLM fiber 45A or B on the side of the fly that is farthest away. The slope of the platform allows the DLM electrode to enter the dorsal cuticle at a 60 to 90 degree angle, which aids penetration. Using the software in oscilloscope mode, look at the computer monitor while inserting the recording electrode into the thorax. When the electrode has entered a muscle, the baseline drops to near 0 or a negative value. Test with a single stimulus to see if you can observe the muscle response. Insert the other recording electrode into the TTM on the side of the fly that is closest to you. This electrode is inserted laterally, in front of you, due to the location of the muscle attachment site. Again, observe the monitor while doing this. Once the trace indicates the electrode is in the muscle, test with a single stimulus to elicit a muscle response. To begin stimulating the brain and recording responses from the leg and flight muscles, apply a 0.03 millisecond stimulus across the stimulating electrodes, starting at 30 volts and increasing to 60 volts, until you observe a muscle twitch and a muscle cell depolarization on the computer monitor. For the remainder of the experiment, set the voltage to 5 to 10 volts above the response threshold. To measure response latency, give at least 5 single stimuli with a 5-second rest period between each stimulus. Determine the frequency of following by providing trains of stimuli at different rates. Typically, 10 trains of 10 stimuli are given at 100 Hz, 200 Hz, and 300 Hz. Allow a rest period of 2 seconds between each train of stimuli. This figure shows responses recorded from the TTMs and DLMs following a single stimulus applied to the brain. The response latency is the time between stimulation of the brain and depolarization of the muscle. A healthy preparation and proper recording technique are indicated by latencies between 0.7 and 1.2 milliseconds for the GF-TTM pathway and between 1.2 and 1.7 milliseconds for the GF-DLM pathway. The latencies can vary with genotype, genetic background, temperature, and age. As shown here, recordings from the TTM show more variability in terms of amplitude and shape of the postsynaptic potential compared to those from the large DLM fibers. This increased variability is due to the small size of the TTM muscle fibers. This variability, however, does not affect the response latency values for the giant fiber 2 TTM pathway. This figure shows TTM and DLM stimulation at 100 Hz and 200 Hz. At 100 Hz, both TTMs and DLMs respond to all 10 stimuli. At 200 Hz, the TTM responses remain 1-to-1, however the DLM responses start to fail. The reason for the DLM failure to follow at stimulation frequencies above 100 Hz is because the intermediary chemical synapse between two interneurons does not have sufficient time to recover between stimuli.
Once mastered, this technique can be done in approximately 30 minutes.
After watching this video, you should have a good understanding of how to monitor neurotransmission through the giant fiber pathway. This is done by stimulating the giant fiber interneurons in the brain and then recording from the jump muscle and flight muscles in the thorax.